Hello, everyone. My name is Aishwarya Arjunan, and I am a genetic counselor here to speak with you about the importance of family health history. Here's what we're going to go over today. First off, what is family health history? The importance of knowing your family health history, how you can use your family health history, what are the risk factors that can impact it, how do you go about collecting your family health history, and any other resources that might be helpful for you if you want to learn more. So let's start with what is family health history? A family health history is a record of health information about a person and their close relatives. A complete record includes information about 3 generations of relatives, including children, siblings, parents, aunts, uncles, nieces, nephews, and cousins. Family members share their genes as well as their environment, lifestyle, and habits. So we all recognize certain traits such as curly hair, dimples, or athletic ability that might run in families. But risk for certain diseases such as asthma, diabetes, cancer, and heart disease can also run in families. Everyone's family history is different. But by noticing patterns among our relatives, healthcare professionals can determine whether an individual or family member or even future generations might be at an increased risk of developing a particular condition by looking at your family health history. What's so important about knowing your family health history? Well, you might have noticed that whenever you visit a new healthcare provider for the first time, you are asked questions about either your own history of diseases or the history of diseases within your family. And there's a reason for this. Most people have a family history of at least one chronic disease, such as cancer, heart disease, and diabetes. And if you have a close family member with a chronic disease, you may be more likely to develop that disease yourself, especially if there's more than one close relative that has the disease, or a family member got the disease at a younger age than usual. Knowing your family history is important because many diseases also have a genetic component. And if we know about diseases that run in the family now, then we can start screening for them early and often prevent them. And knowing your family history can help figure out if you have a higher than usual chance of having common disorders, such as heart disease, high blood pressure, stroke, certain cancers, and even type 2 diabetes. These are really complex conditions that are influenced by a combination of different things, including our genetic factors, the environment, and lifestyle choices. So this information can really allow you to work with your healthcare provider to take steps to reduce your risk. And you can also share this information with other members of your family so they're also informed and can take action if needed. Take action. So what do I mean by that? How can you use your family health history? Well, here are some examples from a physician at Northwestern Medicine on how family health history information can be used. For example, if you have a history of high blood pressure or high cholesterol in your family, then you can change your lifestyle to reduce your risk of developing these diseases. Or if you have a strong family history of cancer, such as breast or colon cancer, then your provider may recommend earlier and more frequent screenings, such as mammograms or colonoscopies. For individuals with a family history of mental illness, like anxiety and depression, family history can inform treatment and medication. It's helpful to know if a family member had a good reaction or result with one medication over another. And some individuals are screened for certain diseases during standard prenatal care, but it's important to know of any potential diseases that may run in the family or that other siblings may have had. For example, we might want to know if any siblings had jaundice or needed phototherapy for jaundice after birth. This may seem insignificant, but it helps your physicians assess risk and come up with a care plan for your newborn. While none of us are able to change really our genetic makeup, knowing our family health histories can really empower all of us, our families and our healthcare providers, with the information they need to assess our risks and make changes as needed. Risk is really unique for each disease and varies from time to time based on age, lifestyle choices, and changes in our medical history. When it comes to risk factors that impact our chances of developing a health problem, our genetics, behavior and lifestyle choices, and environment all have a part to play. Our family health history helps capture the effects of these interactions on disease risk. We can look at our genetic information as the instruction manual for our body. Genes carry the information that determines our traits, which are features or characteristics that are passed on to you or inherited from your parents that make us different from one another. Each cell in the human body has tens of thousands of genes. For those that might be unfamiliar with genetics, let's go over some really simple concepts. Genes give the directions for making proteins in our bodies. Proteins are what make our bodies function. And genes are passed down from our parents to the children. And that's why health problems can run in families. We share our genes with our parents, siblings, and children. Sometimes our genes might not work properly. And when our genes don't work correctly, sometimes you might hear the term used, our genes have a mutation in them. This can cause disease. It's important to realize, though, not every change within our genetic code leads to disease. Some things just make us different from one another, such as our hair color or eye color, but there are certain changes in our genetic makeup that can either lead to disease or put us at increased risk of developing a disease. Our behaviors and lifestyle choices can also significantly affect our health, regardless of our family health history. Our environment includes harmful agents in our food, air, and water. For example, a farmer may be exposed to chemicals in the field. Perhaps they have a genetic tendency to develop cancer because several of their family members have had cancer. Their environment would also then affect their risk. Another example could be families who suffer from asthma. Perhaps they live close to a factory or freeway that could trigger asthma attacks. Plus, they already have a higher risk for developing asthma because of their family history. So these are different ways in which our environment may exacerbate certain risks that we already carry within us. Our behavior and lifestyle choices can also significantly affect our health, regardless of our family health history. Things like a poor diet, lack of physical activity, smoking, not getting the recommended screening tests like mammograms and colonoscopies or blood pressure checks are all behaviors that can be risk factors for many health problems that run in our families. All of these risk factors are connected. Our family health history is really more than just our genetics. Our genes interact with our behaviors and our environment to cause disease. So together, these risk factors all inform our family health history. Even though we may not be able to change our genetics, we can certainly have control over our behaviors and environment. Making changes within our lifestyle choices and our environment can help reduce your risk, as well as reducing your family's risk of developing certain health problems that other family members might have. Remember, we all have a family history of something. Chronic health problems such as heart disease, stroke, asthma, cancer, diabetes can all run in families. Even things like depression, Alzheimer's, or pregnancy problems can affect several members of the same family. Everything that you see on this slide has a genetic component and can run in families. So now that we know what a family health history is and why it's important, let's talk about how we go about collecting one. First, the simple thing, start talking to your family. Write down the names of all of your close relatives. Talk to these family members about what conditions they have or had, what ages those conditions were first diagnosed. You might think that you might know about all of the conditions that your parents or siblings may have, but you might be surprised at what you find out. Ask questions. Ask your relatives about which of the diseases they had. You can talk about specific diseases and ask them, did you have a history of heart disease or diabetes, or things like high blood pressure or high cholesterol? You can ask if they've had other conditions such as cancer or stroke, types of cancer. How old were they when these conditions or diseases were diagnosed? And even if someone doesn't know a specific age at which they were diagnosed, approximate ages are still useful. Ask about your family's ancestry. From what countries or regions did your ancestors come from? What are the causes and ages of death for relatives who have died? Make sure you write all of this information down. And my family health portrait is a free web-based tool that's really helpful in organizing all of this information in your family health history. And it also makes it really easy for you to share this information with your healthcare provider and other members of your family. And make sure that you share the information. If you're concerned about diseases that are common in your family, talk with your doctor at your next visit. Even if you don't know all of your family health history information, share what you do know. Family health history information, even if incomplete, can help your doctor decide which screening test you need and when those tests should be done. And if you have a medical condition such as cancer, heart disease, or diabetes, be sure to let your family members know about your diagnosis. If you've had genetic testing done, share your results with family members. If you are one of the older members of your family, you may know more about diseases and health conditions in your family, especially in relatives who are no longer living. Be sure to share this information with your younger relatives so that you may all benefit from knowing this family health history information. And make sure that you keep it updated. See if you can track down death certificates and other family medical records. Use family gatherings as an opportunity to have open dialogue and conversations. Some people may be willing to answer only some of your questions or ask that you keep answers between you and your healthcare provider. And that's okay. Sometimes this information isn't comfortable to share with everyone, and everyone might not be super open about it. But you can definitely ask the questions and then respect the answers that people give you. Collect the information that you can and respect your relatives' wishes. And if you want additional information about family health history, feel free to check out these websites as well. The CDC has more information, My Family Health Portrait, and the National Genetics Education and Family Support Center. Here are all the sources for the images that were used, but thank you all for listening. And if you have any questions, feel free to reach out to Molly at the National Family Center with any questions. Thank you.